Good morning, I'm Dr. Peak. I want to show you this morning a procedure we did in the office on a patient with a diabetic ulcer with osteomyelitis in the foot as well. I'm a professor in the Academy of Minimally Invasive Foot and Ankle Surgery, and we're expanding our paradigm into the diabetic foot to try to save people's feet with procedures they can afford. This patient actually is a working man, doesn't have insurance, he has to pay for everything, so this is fairly significant for him. So if you look at this is his foot now. I'll show you the preoperative picture. If you look at his foot now, you can see the ulcer that he had in the fifth metatarsal head is now completely resolved. We're actually going to let him go back to work after today. So what we did with him, he had a fairly significant ulcer in the plantar aspect of the left foot under the fifth MPJ. So had a little osteomyelitis too. So what we did, went into the side of his foot here, and we denuded some of the osteo, which was in actually the shaft of his bone here, and we basically raised the metatarsal head up. Now we'll show you the x-rays too. The x-rays there's still some healing going on, but it's a secondary bone healing. But he's in full weight bearing, not wearing a cast or anything like that. Never did wear a cast. Basically, we did have to put him on IV to kind of help with the infection, but we were able to save his foot and to stop this process for the potential amputation. Let me ask you this: before you came to see us, how long did you have the ulcer? You remember?
It's probably been a while, maybe 6 or 7 months.
So you had the ulcer for 6 or 7 months, and you were having to work like this, right? You were working on it. It was getting really bad. So basically, his options were fairly limited. This is an example of what we can do with minimally invasive surgery in the office under local anesthetic. Now, if this were to be handled in the office, or the hospital, or having an admission, this would have cost tens of thousands of dollars. Well, we did this in the office. He still has some costs with the IV antibiotic, which we were able to do outpatient, much less expensive than it would have been in the hospital. So when he came into us, he was becoming sick with the foot. He was getting chills and fevers, and he had a significant infection. So we did treat the infection, but we also got rid of the ulcer where to go away. We did that through minimally invasive surgery under local anesthetic in the office setting.